How to explain seronegative Ra to others. Imagine trying to understand a puzzle where some pieces are missing. That's similar to how doctors diagnose seronegative rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks the joints, causing inflammation, pain, and stiffness. Usually, doctors look for specific antibodies in the blood called rheumatoid factor and anticyclic citrullinated peptide. These help confirm the diagnosis of rheumatoid arthritis. But in seronegative rheumatoid arthritis, these antibodies are not present, which can make diagnosis trickier. Even without these antibodies, people with seronegative Ra often experience symptoms just like those with the more common form. They have joint pain, swelling, and stiffness, especially in the morning. Fatigue is also common. The symptoms tend to affect multiple joints on both sides of the body, like the hands, knees, ankles, hips, and elbows. Because the typical blood tests are negative, doctors relying more heavily on physical exams, patient history, and imaging tests like X-rays to see joint damage or inflammation. It's important to understand that a negative antibody test does not mean the disease is less serious or that symptoms are not real. Seronegative rheumatoid arthritis is a recognized medical condition. Sometimes, over time, people initially diagnosed with seronegative Ra may develop detectable antibodies, and their diagnosis might change to seropositive Ra. This is why ongoing monitoring is essential. Treatment for seronegative rheumatoid arthritis is similar to that for seropositive Ra. It involves medications that reduce inflammation, relieving pain, and slow joint damage. Early diagnosis and treatment are key to maintaining joint function and quality of life. Always remember, managing rheumatoid arthritis requires personalized care from healthcare professionals. So, when explaining seronegative rheumatoid arthritis to others, emphasize that it's rheumatoid arthritis without the usual blood markers but with similar symptoms. Diagnosis depends on clinical signs, imaging, and inflammation markers, not just blood tests. And treatment is focused on controlling symptoms and preventing joint damage, regardless of antibody presence. If you or someone you know has symptoms like joint pain and stiffness, it's important to see a healthcare provider for proper evaluation and care.